You're watching CCN, Clarksville Community Network. Produced by Goodwin Productions. Powered by CDE Lightband.
After the growing spread of the coronavirus, Austin Peay State University announced that their students would continue their spring semester online after returning from an extended spring break in March earlier this year. After months of following the trends and spread of the virus, Austin Peay is happy to welcome their students back this fall. Today, I am with Drs. Perry Scanlon, Andrew Luna, Ramanjit Sahi, and Michael Wilson, who have all worked together to create a model to see how classes will look this fall. Welcome back to Good News Clarksville. Thank you for joining me today. I'm very delighted to be in a room with such intelligent people who have worked to create a mathematical model to see how COVID-19 will affect Austin Peay State University's campus this fall. I am joined with Mr. Michael Wilson, Dr. Perry Scanlon, Dr. Ramanjit Sahi, Dr. Andrew Luna, and Dr. Vajira Manathunga is also a part of this great team but was not able to join us today. So I just want the Clarksville community to know who you guys are and what you do on Austin Peay's campus. Can we start with Mr. Wilson and just tell a little about what you do, what your typical day is like for you?
Okay. Again, my name is Mike Wilson. I direct the GIS Center at APSU. GIS stands for Geographic Information Systems. What I typically do is work with the community on various mapping and technology projects. So my day is mostly, again, working with the community, and then we have students that work for us to help us with that work.
Thank you, Dr. Scanlon.
Yes, I'm Dr. Perry Scanlon. I am the program director and professor in the Department of Allied Health Sciences Medical Laboratory Science program. And my background is in virology, so obviously with COVID-19, we're spending time thinking about how we can help campus.
Thank you. Dr. Sahi?
I am Dr. Ramanjit Sahi, and I come from the Department of Mathematics and Statistics. I'm the graduate coordinator in mathematical finance, which is a part of the Computer Science Quantitative Methods Masters and PSM program. And I am a professor too. I am also working on actually COVID-19 research with one of my graduate students right now. So hopefully we'll be able to get some results. And also I teach some math courses, undergrad as well as some grad math courses. I'm looking at them.
Thank you. Dr. Luna?
My name is Andrew Luna, and I'm the Executive Director for Decision Support and Institutional Research. What my team does is we collect data for the state and federal government and for planning purposes of the university. So we're pretty big into statistics and using methodology for planning.
Thank you. So let's start from the very beginning. I know that you guys had your first meeting in late March, but before that meeting, how did you come up with the idea to create a mathematical model?
Well, I think I can answer that. So in my situation, I had worked with the COVID-19 task force as we were transitioning to classes online in the spring. And as part of that, we're also preparing for fall. And we thought about, how we can best help care for students, faculty, and staff on campus. And my first thought as a virologist is there's a lot of information about how, the virus is being transmitted in the community and how we can protect ourselves. But we need to think about how we can build a model to help protect students, faculty, and staff on campus. And so I realized that, there's a marriage between science and mathematics. And with the data, both that GIS does and institutional effectiveness and research has as well in terms of institutional data. So I gathered a group of individuals from actuarial science and mathematical finance, as well as the institutional folks. You see here to work with us to build a model that we can predict some things about how the virus might impact campus in the fall.
Okay. So can you walk me through the very first meeting? I can imagine you all coming in a room and using all of these scientific and mathematical terms that I probably can't even comprehend. So can you walk me through that very first time when you guys got together and started to create the model?
Well, first of all, it wasn't in a room. we're all looking at each other on a computer screen. With the exception of Michael, I didn't know anybody else. I was happy to have been asked to participate. We were just brainstorming, trying to figure out ways. And I think the important thing here is we have people from, myself, I'm an administrator, we have faculty, we have these minds that have basically may not see each other on a typical day-to-day basis on this campus, that have gotten together not just for the benefit of Austin Peay, but for the benefit of Clarksville. And so that was a really neat opportunity I felt, to be a part of. And then it was just trying to get to know each other, look at everybody's experience and what everybody had to offer. And of course, Dr. Scanlon has the knowledge of what's going on. Most of the rest of us are number people, but he clearly had the knowledge of what was going on and the literature review. And so we were able to take his lead and come together in a consensus of what we were going to try to do.
Okay. Did anyone else want to respond about the first experience when you all met?
I can just simply add a little bit to it. I didn't come on the very first time, but I was invited later on by Dr. Scanlon because I was talking with Dr. Vajira Manatunga, and we just started talking about the research I'm doing. And so he said, yeah, why not join us? And he talked to Dr. Scanlon, and he invited me. And in the second meeting I was there, I realized it was amazing to see different approaches. For me, the reason is because I'm a math modeler. I love real life problems and how I can solve it using things which I have from my math, background. So the first part I realized was, yes, it's a real life scenario. And then we were talking, how to look at it model. And I said, why not start from a very simple, basic thing? And that's where the model started to really move on from there. And then, Mr. Wilson helped me, joined me on, and I and him have worked a lot before. So and I kind of knew him the most, and from that, I'm really enjoying my time here with this group.
So, Dr. Scanlon, can you tell me, as a virologist, were you tracking the coronavirus from the very beginning, or when did you decide to become more engaged?
Yeah, so on a personal note, just as a personal interest, I started kind of watching things as they unfolded in February and even in January when we started getting reports of what was happening. And there was a lot of discussion. The folks in medical lab science do all the testing. So when testing wasn't rolled out right away, that was very concerning to all of us. So I started looking at it back then, but then, as we started moving classes online, we started being more cautious and watching what was happening on a day-to-day basis. So as part of the COVID-19 task force, I basically tracked the COVID-19 in Montgomery County and in Tennessee pretty much, every day since mid-March. So we've been kind of continuing to work on tracking what kind of cases are happening here locally as well as Tennessee as a whole, and then generally what is happening with infection and transmission, nationwide.
Okay. And Dr. Sahi, and I'm not sure if you can speak for Dr. Manathunga, but as actuarial scientists, how did you guys, could you first explain what actuarial science is for those that are watching, and how did you guys contribute mathematics into the model?
Actuarial science basically is related to insurance in very simple words. And, we have insurance for everything, as simple as car insurance. That's the simplest way to look at it. It's just basically protecting ourselves from unseen circumstances. It's like a risk over there. And when it comes to mathematics, it's part, actuarial science is kind of it's a part of mathematical finance. Me and Dr. Manatunga have been collaborating a lot for times on different ideas. So we always talk about things we are doing and how we can help in promoting our master's program, and also at the same time the actuarial science concentration, which is newly been added to our program. So and math, finance, and actuarial science go very much hand in hand. Okay. So that's how and we started looking at models, and math models are a lot in abundance. The biggest one which is used, if you go online, is going to be the SIR model, and that's what has been the main model we have all been working on. And if you think what's an SIR, very simple, guys. It's susceptible, infected, recovered. That's the base model we work on.
Thank you. Dr. Luna, can you tell me the work that you do as the Executive Director of Decision Support and Institutional Research, how did that work contribute to the model?
Well, twofold. Number one, they wanted to be able to look at real numbers. We know the statistics of what's happening, of where the virus is affecting most people, but how many 60-year-olds do we have at Austin Peay State? How many males, how many females? So that's in my wheelhouse. So I was able to provide to the group the demographic statistics for students and for staff and faculty. And then the other thing is, just as a statistician myself, one of the difficult things about this kind of modeling is most statistical models depend on some kind of a trend. There's really not a trend here. I mean, this is something you can go back to the Spanish flu back in the early 1900s, but there's really no trend here. So it takes people from all different walks of life and all different methods of science to be able to figure out how can we extract a model that's going to be able to give us, what we need. So I was able to, in a small piece of a part of this, be able to contribute.
Okay. So you said there's no trend. What do you think makes the virus different to where there isn't a trend compared to other viruses?
Well, I mean, the only reason I'm saying that, and Dr. Scanlon can add more, but I mean, this is the first time that it's happened. I mean, the only trend that we have is stuff that, when it first came about in the United States, I think in the middle part of January, that's trend. Normally when you're working on statistical models, you're talking about trends over months or over years, times like that. But this is a first time, type of thing. So you really don't have trend data.
Thank you. And Mr. Wilson, can you tell me the work that you do at Austin Peay's Geographic Information System Center, how did that contribute to the model?
Well, I think initially I got involved in this due to we had started mapping cases of COVID-19 in Tennessee back in early March. And so we had started at the GIS Center, had started collecting data and posting it online. So we were looking at this type of data. And I think I've actually been blessed where I've worked with everybody up here in the past. And I guess I have a reputation as somebody that will work on anything and try anything. And so I got involved. Now, ironically, I guess I had also, back in January, started saving any mathematical models I found that had to do with the virus. And I think we used one or two of those articles I had happened to save in our initial push to find some stuff. So I am not a math person, but I'm very much applied, where my, I guess, research area is working with decision makers to tease, to make data into information they can then make decisions.
Thank you. So I read that the overall goal is to eliminate the spread of COVID-19 on Austin Peay's campus this fall. Are you guys confident that that model will help with that?
So I can say that the goal is to reduce. Eliminate would be wonderful. I don't think anybody's thinking that we could eliminate it completely, but it would help us inform the administration as well as the community and students and faculty and staff where we might be seeing increases if we see them, or how we might intervene. So as Mike Wilson was mentioning about GIS, we had worked on some H1N1 tracking on campus several years back. And so the thought was that if we can look at some proximity tracing as well as what the model is offering us in terms of what we see, maybe we can find places where they could be infection and maybe mitigate the spread in those locations, or encourage people to do more social distancing, wear masks, to help protect them. So not only can we maybe do some predictions about what might happen, but we could also find ways that we can stop the spread if it would occur on campus. And so information is power, knowledge is power, and so having information and models available can tell us some things about how we can make a difference to keep people safe.
Thank you. What types of changes should students, employees, and those who visit Austin Peay's campus expect to see when they return this fall?
I think some of the biggest changes is, again, the enforcement and strong encouragement for social distancing to keep that going. Additionally, the wearing of masks. And Austin Peay's also added, and Perry can speak to it, several other, I guess, policies and mitigation practices to help keep our community safe.
Okay.
I can talk about a little about the classes we are looking at, and Dr. Perry can definitely help me on that. We are looking at some hybrid models, so where we can have, say, if it's 3 days a week we are meeting, so 2 days a week we meet, and third day, they can have, that's one of the options. Third day is that they can work through online, or it can be all 3 days we're meeting and it's only like 1/3 of the class coming. It all depends upon how things go. Like that's only for our Monday, Wednesday, Friday classes. But if we have Tuesday, Thursday, most probably it's going to be like half the class, like depending upon the number of students, how many half can come, the first day, and the second, say Thursday, they can come on the other half. And at the same time, there is simultaneously all the lectures and everything are being done online. So nobody is going to be, losing anything. But definitely, I actually miss my students a lot. I want them now. And even I'm getting a lot from my students that they want to have in class, and specifically some really, statistics classes, because it's a statistical model, right, Dr. Luna? And those classes are not, those classes really require one-to-one, and online, not an online, sorry, on-ground classes.
How far should we take it as students, employees, and visitors on campus to eliminate or reduce the spread? Should we try to take alternative routes to reduce crowding? What all should we do to reduce the spread?
Well, I can say that the biggest thing is wear your mask. I know that administration and those involved with the COVID-19 task force really care about people's safety. So, when they give recommendations or indications of what we need to follow, I think we should follow those. But wearing a mask inside, limiting contact with others. If you have a close group that you're in contact with, not to extend that into multiple large groups where you can be exposed. So in terms of following some of those directions would be to mask, to distance, to follow some of the flow and signages about how we might go in and out of rooms or around campus. We definitely would want students back. We're excited to have them back for fall, and for us, it's offering that same level of great service while also keeping everybody safe. And so masks, staying out of crowded areas, using room spaces that are larger than maybe typical to spread people out. So all of those are ways that the administration and faculty and staff at Austin Peay are doing things to protect the students that are there. So, but it is crucial to prevent the spread, to wear your mask, to social distance, and to make sure that if you are feeling ill, that you remove yourself from campus, stay home. I think everybody would agree that if you're not feeling well, to make sure to stay home and stay out of areas where you're contacting other people.
Thank you. So how should students who live on campus expect the dormitories to change?
Yeah, I can say that I know that they're planning some things for some of the shared spaces in handling food a little differently so that people can pick up a grab-and-go things or to reduce density in public spaces. But I know that Joe Mills and the folks in housing are working very hard to make sure that everything is safe and that hand sanitizers and masks and those things will be available. So I strongly think that housing will continue as we have used them in the past, but with extra safety measures to keep everybody safe.
Thank you.
And Sydney, one of the things I want to throw out is you tend to judge what's going to happen in the future by what's happened in the past. When this hit, there was a national survey that went out that institutions could participate, and we participated in it for students, staff, and faculty. And it was a survey that was essentially asking people how do they believe that their institution handled the COVID-19 response. One of the things that it didn't really surprise me, because I've only been here about 2 years, and I've know that this is a really strong community, but students, staff, and faculty were very impressed with the communication that came out from the institution. They were very impressed with the quick action that the institution took in moving everything online. And the constant communication, letting people know what's going on. I think we can see that moving toward the future, because anything could happen. It could get we could have a spike, or we could be where all systems are normal. And things quickly move in this thing, and so the institution clearly has been in a situation where it has really tried to keep everybody informed. And so to get that kind of response from students and staff and faculty, I clearly believe that communication effort and that constant vigilance of what's going on is going to be part of the APSU community as we move forward.
Okay. So Austin Peay released that I think the fall break will be eliminated and students will be going home November 25th and doing their final exams online. What were to happen, or is there a protocol in case if coronavirus takes over, or not takes over, that's probably a bad term, or what happens if there are a few cases to come to campus? Should students and employees expect to work from home sooner than November 25th?
There's a possibility. What we have been getting informed, we actually have weekly meetings with our provost right now, the interim provost, Dr. Mai. She's an amazing provost, and she's making sure that all our concerns are being heard. We kind of have 1 hour, but have for the past twice weekly meetings, it's gone more than 1 hour. And amazingly, they're asking our opinions, surveys, as Dr. Luna was saying. The community has a very good response, like the APSU faculty community, and based on all that, we're getting our responses. What I see is, yes, if it happens, we are being also told that if by chance, I'm crossing my fingers, it should not, we are ready to actually take action in a second. Right. We are preparing both sides on that.
Thank you. So I read that you guys, once you tackle Austin Peay, you're hopeful that your model can help the Clarksville community and eventually the state of Tennessee. Are you still confident about that?
Well, I certainly hope that whatever lessons we learn on campus, we have sort of almost a small city. We consider ourselves family at Austin Peay, including the students. So that family environment we have there is a unique population. And, as population changes, whether it's city, county, or state, the better the model gets and the more information we have, the better we can offer help to the community. And so obviously we care about Austin Peay, but we care about our community as well. And if there's any way that our model can work to help the community, we're certainly all for working with as many, community partners as possible, because the community are what helps make Austin Peay great.
Thank you. Do you guys have anything else you want the Clarksville community to know about your model that you've created, or how hard you've been working?
I can definitely talk on that. So the one as we started with, was very simplistic model, very simple. Just looking at the averages, how it's going to impact. We all sat together as a team. We looked at how it was happening in the whole state of Tennessee. And then we looked at some of the averages. We looked at the worst scenario, the mediocre, and the best scenario. So we looked at all possible ways we could start with, and then we started talking about how we can look at things specifically in terms of SIR. That's the best one we use, and that's actually the one which is used prominently everywhere if you have any infectious kind of diseases. So when that's what we are basically based on, the SIR models. And here what we're looking at is we're looking at different scenarios. We're looking at, suppose we add social distancing. Okay, so then how would that impact our community? Specifically, APOC is like a very tight-knitted community, and I'm so happy to be there. And then at the same time, we're also looking at, so if you can do contact tracing. Then also we are looking at, what else, guys, we're looking at? Just add proximities.
The thing to remember, particularly with social distancing, is one of the factors we're looking at is how effective is social distancing? Are people always 6 feet apart? Or do they cheat a little?
Are you saying pre-COVID or?
No, I'm saying in our models, one of the things we're looking at, which is interesting, is just how effective social distancing is. Am I walking around with a 6 foot bubble around me, or periodically am I maybe, I just went to the store the other day and I walked down the aisle and the aisle's not big enough for two people to be. So how effective is social distancing is one of the more interesting aspects of what we're looking at. And that's, again, been very informative to me, that we could actually sit there and look at how does that affect things, or can we estimate how stringent people are being.
There's one thing that I would mention that is an underpinning of the model is what kind of data we're getting. And I work in medical laboratory science, and so there's a whole group of professionals out there that are dedicated to just collecting the appropriate test data and do appropriate testing. So obviously sample collection is not the same as actually performing the test. And so MLS folks, medical lab science folks, are performing the testing. But here's the key: if you're performing tests that aren't very good, or they don't have the specificity or sensitivity. So as you can imagine, with the emergency use, there's a variety of testing available, some serology, some antigen test, the gold standard PCR. So the better the testing is and the better data that we get from that will help the models improve, whether it's our model or anyone else's model. And so making sure that the data that we have is accurate, precise, and excellent in terms of specificity and sensitivity, which means, can we predict when we test that it's positive? So you can imagine in your situation, if you get a lab test done, you want to make sure that that test is correct each and every time. So the better the testing that we do, the better results we get, the better we can model and figure out what is happening. And so folks in medical lab science, that's what we spend our life doing. And so it would be remiss without telling the public and others that, the quality of testing matters, the quality of professionals performing testing matters. And we believe that if we stick to that, this will help our models produce even better data.
Thank you. Since Austin Peay's campus has been closed, has Austin Peay worked to gather adequate testing for the fall?
Currently, I know the administration is looking at various scenarios and how they can implement testing or work with community partners to provide testing. So I would say that students have access to health services and availability of that office. And I know that that group has worked tirelessly to make sure that both physical and mental health services are available to students. So I am sure that there will be a plan in place to handle students that may feel ill or are concerned about COVID-19.
Thank you. Did anyone else want to share any last comments?
Yes, I definitely would like to share, and it's about my students. Okay. Like we're talking about math models. Our master's program, we have at least 2 students who are literally working into this COVID-19. One of them is looking from more mathematical point of view. The other one is looking from more predictive point of view. And those are actually our concentrations in our master's program. The one I am working myself with, we are looking into the socio-economic impact of this COVID-19 on specifically Tennessee and specifically major cities. So one of the cities we are definitely looking into is Nashville, and then we'll see how it can help, that model can help also in terms of Clarksville. So I definitely want to also, let the community know that our students are also very much involved with us.
Thank you. Well, I want to thank you guys as a student and member of the Clarksville community for all of the hard work that you've been doing. I truly appreciate it. And thank you for joining me today.
Thank you. Thanks for having us here.
Thank you.
For current and exclusive content, subscribe to CDE Lightband, connecting you at the speed of light.